Colon cancer is one of the most prevalent diseases in the United States. New York-Presbyterian Hospital has spent a lot of effort to try to educate patients about the importance of screening. Screening colonoscopy can save lives.
It's a preventable disease. All colon cancers and rectal cancers form in polyps, which are growths within the tissue of the colon and the rectum. These polyps undergo changes that make the cells grow out of control, and that's what leads to cancer. This is preventable because if a colon polyp is removed before those changes happen, the cancer can be prevented.
Actually, probably the most important risk factor for colorectal cancer is family history. So if there is a family history of colorectal cancer, that's probably extremely important and should be discussed with your doctor. There are certain specific genetic syndromes which increase a risk for colon cancer or for colon polyps, and your physician should be able to recognize that if there is such a family history. And patients who have inflammatory bowel disease, things like ulcerative colitis or Crohn's disease, have an increased risk of colorectal cancer. Aside from that, there are certain lifestyle issues that may play a role in colorectal cancer. And there may be associations with various diets, perhaps certain vitamin deficiencies, and certainly smoking has been shown to increase the risk. So lifestyle may play a role, but probably the most important role is your family history. Like most cancers nowadays, the best treatment requires a team. You need to have a team, and that team should be in place before you get there. That is one of the things we've worked so hard for, and I think have achieved well here at New York-Presbyterian. So we have a team in place, and the team is really multi-layered. It starts perhaps with the gastroenterologist who may make the diagnosis at the time of a colonoscopy. Patients are then referred to radiology for the appropriate scans that need to be done to determine clinical stage. Patients then would typically see a surgeon to discuss surgical options. But at the time they see the surgeon already, the medical oncologist is on the team, and if appropriate, even the radiation oncologist. We also have geneticists, we have nutritionists, we have social workers, and all of them are used to seeing patients with gastrointestinal cancer. This is what we do every day. And so this team is in place, and this is tremendously important to a successful outcome. The days of a patient seeing a surgeon only after the diagnosis or being sent directly to the medical oncologist without the surgeon having input are really over. The best outcomes are going to be with a multidisciplinary team. We have in place an excellent team, but as that team was being formed and as the entire program was being developed, at every step of the way, patient comfort, privacy, a very patient-oriented approach was made to everything that was designed. So we have patient navigators to help patients through the process of getting from test and to doctor and to treatment. We have a brand new infusion center. So for our patients who need to be treated with chemotherapy, we have an absolute beautiful, brand new, state-of-the-art 13-bay infusion center where patients have privacy. The unit is light. We have wonderful dedicated nurses and a full-time pharmacist. The environment is, I think, a very pleasant and warm environment for what undoubtedly is an extremely stressful experience. And we worked very hard at that, and I think it is unique. I don't think other centers really have achieved it, I think, as well as we have right now. And I think that is a very important aspect to the program.